After you've suffered an injury in an auto accident and you come into our office, the first thing that's going to happen when you walk in the door is you're going to be greeted by a very friendly, understanding, empathetic, sympathetic staff. What you'll find is most of our employees here and the people you're going to be working with have been through this before. They have been injured and they have had to go through this treatment. So not only do they know what you're going through, but they know what it takes to get out of it and get better so that they all have their normal lives back again. Once back in the room, we're going to go through a full physical examination. We'll start off with a full history of what happened and how it happened. We pay attention to every little detail. What part of your car was struck? Were you looking one way or the other? These little things that you might not think make a difference make a huge difference into the nature and severity of the injury, and all of that information plays a role into ultimately what becomes your treatment plan to help you get better and get through this. After the physical exam is performed and the history is taken, we will then do x-rays. X-rays for me are not to find the problem. Most of these injuries are soft tissue injuries. However, the treatment for these injuries is a physical treatment. This is physical structural damage, and we need to do physical structural treatment for that damage. Getting x-rays and reviewing them before we start treatment is for us and you to see structurally what it is we're starting with. We want to know that it's safe to do what we're going to be doing. In doing these x-rays, we look for weird, out-of-the-ordinary things that may stop us or change our plan. So, again, we want to know that it's safe to do what we're going to be doing. Once those x-rays are done and reviewed with you in the office the same day you come in, we're going to talk about your injuries and we're going to talk about the treatment that needs to be done for those injuries. Because of this being a soft tissue injury, soft tissue covers a whole array of issues. Soft tissue is muscles, tendons, ligaments, and disc. All of those structures have some role in your vertebrae or your joints. These structures are what attach to the joints, hold it in place, and move it. If there is damage to a disc, or muscles, or tendons, or ligaments, the joints that they hold and control are going to be irritated and often damaged as well. So, these injuries are approached from 4 different angles. 1, we want to make sure through manipulation that the joint is lined up and mobile and in place and moving the way it needs to be. Number 2, we're going to strengthen and rehabilitate the damaged tissue so that whatever that tissue controls is moving and functioning the way it should. Number 3, through passive therapy, we're going to help reduce swelling and inflammation. The 4th aspect is medication. We have a nurse practitioner on staff who will evaluate you, and if necessary, provide medication. Medication will help with the initial few weeks of pain and swelling. Rehabilitating an injury like this is going to be very frustrating because it is a very slow process. This is not something that happens quick and overnight. This is a very slow, gradual thing. So what we're going to be doing initially to work on the cause of your pain is not going to get rid of your pain quickly. The medication is in place to help with that. The goal is to get you off of that medication as quickly as possible so that what symptoms you are feeling are more manageable and tolerable, but ultimately over time, slowly, gradually, progressively getting better. Not necessarily getting better so much pain, but getting better in that you're functioning better at work, your mood is better, you're sleeping better, you're able to get back into your normal life. If you are not improving the way we expect, advanced diagnostic testing may be needed, such as an MRI or a CAT scan. Depending on the results of those advanced diagnostic tests, that'll give us a better idea of what to be expecting out of this long term and why things may be moving a little slower than what we would initially expect. Other options include being referred out for an orthopedic or a neurological evaluation or an evaluation for pain management. What we do here is a really good, really effective tool to help you rehabilitate your injuries. However, there are some injuries that are just so extensive that something a little more may be needed. If a referral is needed for pain management or an orthopedic or surgical evaluation, we will make that referral and get you in touch with the best local doctors. At the end of your first appointment, when you're ready to check out, you are going to know and understand your injuries, what needs to be done about it, why we're doing what we're doing, and roughly how long it may take. I never like leaving a doctor's office and thinking, what was that about? Or I don't know what I'm doing. I'm just doing it because I'm told. I don't like that. I want you to be just as much a part of this as we are. Again, I want you to know what we're doing, why we're doing it, what the goals are, and the promises we make to you is that nobody will work harder at this than we will. The people that you're going to be working around with our staff, they've been through this. They know what you're going through and they know what needs to be done. That's my promise to you. I need you to promise to me that you are going to follow through with this and stick to the program to get this done. I want to get us out of your life as quickly as possible, but better. Visit us at our website at injurytreatment.net or call us to schedule an appointment. I'm Dr. Stuart McCranels. Call us at Injury Treatment Solutions.